Imagine you are alone at home. Maybe it's a quiet evening after dinner or a slow Sunday morning before anyone else is awake, and something shifts in your chest, something you have never felt before. Not dramatic, not the way you expect it, just wrong. Now imagine that in that exact moment, you know what it means. You know the 3 steps, you know the sequence, and when the paramedics arrive, you are still conscious, still breathing, still here. That is not luck, that is preparation, and by the end of this video, you will have it. I'm Dr. Kevin Attawale, and I've spent 22 years as a practicing cardiologist. I've seen patients survive cardiac events that should have been fatal because they knew what to do and they did it. And I've seen patients who didn't make it, not because help was too slow, but because they lost the first 3 minutes. Those 3 minutes are what this video is about. But before we continue, I need to tell you something. There is one factor, one single detail that determines whether everything I'm about to teach you will actually work when your life depends on it. I'll come back to it at the very end. Don't skip ahead. Don't scroll to the timestamp, because without that piece, the rest of this video is nearly useless. Let's start at the beginning. Recognition. The number one reason people lose those critical first minutes is simple. They don't know what is happening. Movies have given all of us the same image. A man clutches his chest, staggers, and collapses instantly. That does happen, but it is not the most common presentation, not by a long way. In reality, symptoms usually build gradually over minutes, sometimes over hours, and many people spend that entire window convincing themselves it must be something else. The classic signs include a heavy, pressing, or burning sensation in the center of the chest, not always sharp, not always severe at first, pain that spreads to the left arm, the jaw, the upper back, or the neck, cold sweats that come on without any physical exertion, shortness of breath that appears without obvious cause, dizziness, and a feeling that is difficult to put into words, a deep sense that something is fundamentally wrong. That last one is important. Listen to it. I had a patient a few years ago, 71 years old, healthy, active. She came to see me 3 days after her symptoms started. 3 full days. She had assumed she had indigestion from a family dinner because the discomfort was in her abdomen, not her chest. By the time she arrived, significant damage had already been done. She told me she kept waiting for the chest pain she had seen on television. It never came. This brings me to something I need you to hear, especially if you are a woman over 60. Your symptoms may look nothing like that list. Research on this has been consistent for decades, and it is still not widely enough known. Women in this age group frequently experience cardiac events with little or no chest pain at all. Instead, they feel sudden, overwhelming fatigue, not ordinary tiredness, not the kind that comes from a long day, something that arrives without warning or explanation, like the floor has shifted beneath you. They feel discomfort in the upper abdomen, almost identical to heartburn or indigestion. They feel nauseated or dizzy, or simply wrong in a way they cannot describe clearly to anyone. Because of this mismatch with what people have been taught to expect, women over 60 wait an average of 20 to 30 minutes longer before calling for help. And in a cardiac event, 30 minutes is not a delay. It is the difference between a full recovery and lasting damage to the heart muscle. The rule is this: if something feels wrong and you cannot explain it, call. Do not wait for the movie version. That version does not reflect how it works for most people. And waiting for it can cost you everything. Now, the 3 techniques for while you wait. Before I explain any of them, I want to be completely clear on one point. These techniques buy time. They are not a substitute for emergency care, and they are not a reason to delay making a call. Your first action, always, is to call your emergency number. Everything I am about to show you happens while you wait for that help to arrive, not instead of it. Technique 1, the controlled cough. Here's what happens during a cardiac event that involves arrhythmia, an irregular or temporarily absent heartbeat. The heart loses its normal pumping rhythm. Blood flow to the brain begins to decrease. Within seconds, you may feel lightheaded. Within a minute or 2, you can lose consciousness entirely. When you take a deep breath and cough forcefully, you increase the pressure inside your chest cavity. This mechanical pressure acts as a pump. It pushes blood toward the brain and toward the vital organs. And in certain types of dangerous arrhythmia, this pressure change can actually interrupt the abnormal rhythm. But the window for this is narrow. It is within the first 2 to 3 minutes of onset. Here is exactly what you do. Breathe in deeply, filling your lungs fully. Then cough, hard. Not a polite, restrained cough, a full, forceful, deliberate cough from deep in the chest. Repeat every 2 seconds. Inhale, cough, cough. Continue for as long as you are conscious and physically able to continue. 60 seconds of controlled coughing can maintain meaningful blood flow to your brain while your heart is struggling to maintain its rhythm. That is a trainable, repeatable action that requires no equipment, no other person in the room, and no tools of any kind. Let that sit for a moment. The difference between staying conscious and losing consciousness in those early minutes may come down to something as straightforward as knowing how to breathe and cough correctly. Quick question while we're here. Do you know your resting heart rate? Just a number. Write it in the comments below. I have a specific reason for asking, and I will explain what it means in an upcoming video. Technique 2, the precordial thump. I want to give you the warning before I give you the technique because this one matters. The mechanism, a sharp, controlled blow delivered to the center of the sternum, the breastbone, can generate a small electrical charge across the heart muscle. In certain types of arrhythmia, specifically during the first 3 minutes after onset, this small charge can interrupt the abnormal rhythm. Think of it as a primitive mechanical defibrillator, a tool of last resort, used only when nothing else is available and the situation is clear. How to perform it. Close your fist. Use the padded fleshy area at the base of your fist, just above the wrist, not the knuckles. Strike the center of your sternum. The blow should be firm and deliberate. Not a wild punch, not a light tap, controlled. 2 or 3 strikes. Now the warning, and please take this seriously. If you have osteoporosis or low bone density, this technique carries a genuine risk of rib or sternal fracture. If you are on anticoagulant medications, blood thinners, this technique is not appropriate for you. Know this about yourself before a crisis arrives, not during one. If either of those conditions applies to you, skip this technique entirely and focus your energy on the cough and the breathing. Every tool has constraints. Part of preparation is understanding which tools belong in your kit and which do not. Technique 3, the Hegu point. I know this may seem unexpected coming from a cardiologist. Here's the physiology behind why I include it. The Hegu point is located in a soft tissue web between your thumb and index finger. Firm pressure at this specific point stimulates the parasympathetic nervous system, the branch of your nervous system responsible for calming the body's responses. It is the counterweight to the fight-or-flight system. During a cardiac event, panic escalates rapidly, and what panic does physiologically is real and measurable. It drives a sharp surge of adrenaline, which causes blood pressure to spike and heart rate to climb. This makes an already dangerous situation significantly worse. Activating the parasympathetic system works directly against that cascade. What to do? Use the thumb of your opposite hand and press firmly into that soft tissue web. Apply steady circular pressure. At the same time, control your breathing deliberately and consciously. Inhale slowly for 4 counts. Exhale slowly for 6 counts. The extended exhale, longer than the inhale, activates the vagal response. This is the mechanism by which slow, deliberate breathing works to slow the heart rate. Switch hands every 30 seconds. This technique will not halt the cardiac event. I want to be clear about that, but it can reduce the panic-driven physiological spiral, help you remain mentally oriented, and give the other techniques better conditions to work in. A calm mind in those minutes is not a luxury. It is a clinical advantage. Panic is not neutral. It actively makes the situation worse, and it is something you can counter. Now, the full sequence, because knowing techniques in isolation without knowing the order is its own kind of problem. Step 1. Call your emergency number. This comes first, without exception, before anything else. Put the call on speaker mode so your hands are free. Give address clearly. Tell them you believe you are having a cardiac event. Keep the line open and follow whatever the operator tells you. Step 2. Get to the floor. Sit down or lower yourself gently to the ground. Do not try to walk to another room. Do not try to go open the front door for the paramedics. Do not try to do anything that requires effort or movement through your home. If you lose consciousness, which is possible, you want to already be as close to the ground as possible. This protects your head from injury in a fall. Step 3. Aspirin, but only where appropriate. If you have standard aspirin at home, consider chewing 1 tablet, not swallowing it whole, chewing it. Chewing allows significantly faster absorption into the bloodstream. Aspirin acts against the clotting process occurring in the affected coronary artery, which is the mechanism behind most cardiac events. But this step comes with firm conditions. Take aspirin only if you have no known allergy to it, only if you have no active stomach ulcer, and only if you are not currently on blood-thinning medications of any kind. If you are uncertain about any of those conditions, leave it. Do not guess. The paramedics will make that call when they arrive. Step 4. The techniques. The controlled cough first, then the Hegao pressure combined with the deliberate breathing. Continue both until help arrives. Phone call first, floor, aspirin only if appropriate. Techniques while you're waiting. Keep it in that order. Now, what you do on every other day, because the real goal is to never need that sequence at all. Evening protocol. 2 hours before you sleep, turn off your screens. Phone, television, tablet, every one of them. The blue wavelength light from these devices suppresses melatonin production in the brain. Most people think of melatonin as a sleep hormone, something that helps you fall asleep faster. What far fewer people know is that melatonin is also a potent antioxidant. It plays a direct protective role in the inner lining of your blood vessels, the endothelium. Chronic suppression of melatonin, accumulated over months and years of late-night screen exposure, is associated with measurably elevated cardiovascular risk. This is not speculative. The research on this has been building for over 15 years. Heavy food late at night creates a separate problem. Digestion demands significant blood flow and cardiovascular effort. Eating a large meal within 2 to 3 hours of sleep forces your heart to remain active and working at the exact time it should be shifting into its natural recovery cycle. The evening prescription is simple. Screens off by 8 o'clock or 9 o'clock. Dim the lights in your home in the hour before sleep. Light food only if you need anything at all. Same bedtime every night. Consistency in sleep timing matters to the cardiovascular system more than most people realize. Morning protocol. Put a glass of water on your nightstand tonight. Room temperature. Tomorrow morning, before you stand up, before you check your phone, before anything else, drink it. During sleep, your body loses fluid steadily through breathing and perspiration across 6 to 8 hours. By the time you wake, your blood is measurably thicker and more prone to clotting than it was when you went to sleep. The early morning hours between 5 o'clock and 10 o'clock are statistically the highest risk window for cardiac events. This is not a coincidence. Overnight dehydration, combined with the body's natural morning cortisol surge, creates a set of physiological conditions that elevates risk. Drinking water before you rise helps counter part of that. 30 seconds every morning. I give this instruction to every patient I see over 50. It costs nothing, requires nothing, and it matters. Nutrition, practical and direct. What to add to your regular eating. Fatty fish 2 to 3 times per week. Salmon, mackerel, sardines, herring for the omega-3 content that reduces inflammation in arterial walls. Berries regularly. Blueberries, blackberries, strawberries for the anthocyanins that support healthy blood vessel function. Oatmeal for the soluble fiber that binds and removes cholesterol during digestion. Olive oil for the polyphenols that protect the inner lining of your arteries and support healthy blood pressure over time. What to reduce consistently. Processed and ultra-processed meats, sausages, bacon, packaged deli cuts, hot dogs. These products contain high levels of sodium, nitrates, and certain fats that contribute to chronic systemic inflammation and accumulate damage in arterial walls across years and decades of regular consumption. Not perfection, direction. Those are two very different standards, and only one of them is actually achievable for the long term. And now, the thing I promised you at the beginning, the one factor that determines whether any of this actually works when you need it. Here it is. For a significant portion of the people watching this right now, everything I just taught you will not work when you actually need it. Not because the techniques are incorrect, they are well documented and they work under the right conditions, but because when acute panic strikes, when you are alone and in pain and frightened, the prefrontal cortex, the thinking and planning and reasoning part of your brain, goes significantly offline. Your body falls back on established patterns, automatic responses, things your muscles already know how to do without any conscious thought required. If the first time you attempt to control coughs while you are alone, in acute pain and terrified, you will very likely do it wrong. You may forget the sequence. You may do it weakly when you need to do it forcefully. You may freeze entirely and do nothing. Information read once or watched once is not the same as a trained response. They are completely different things stored in completely different parts of your brain. What saves lives in those moments is what your body already knows automatically, not what you watched in a video and remember intellectually. So, here's what I'm asking you to do. Not this weekend, not at some point soon. Tonight, sit down in a chair, set a timer for 60 seconds, practice the cough technique, breathe in deeply, cough hard, repeat. Let your body physically learn the motion, not just your memory. Then find the Hague point on your hand. Press it. Practice the 4-count inhale and the 6-count exhale 3 full cycles through. Let your nervous system practice being calm so it remembers how to find that state when it matters. 2 minutes. That is the entire request. That is what the difference looks like. And then tell someone who is regularly near you what you learned today: a partner, a neighbor, an adult child, a close friend. Not only so they understand the techniques themselves, though they absolutely should, but because having someone nearby who recognizes the early warning signs changes the outcome significantly. Most people who survive cardiac events when they are not alone survive partly because someone else saw what was happening before the person could fully process it themselves. Before you close this, I want to ask you something directly. Have you ever had a moment you dismissed? A strange pressure in your chest that came and went? An unexplained breathlessness that you decided was probably nothing, probably stress, probably just getting older? Write it in the comments below. I read every single one. I suspect many people watching this have that story and have never told anyone. In an upcoming video, I'll walk through the warning signs that appear weeks and sometimes months before cardiac event. The signals that, if you catch them early enough, mean you may never need what I taught you today. Subscribe so you don't miss that one. If this was useful, a like helps other people who need the same information find it. I'm Dr. Kevin Attawale. Stay informed, stay protected.